On today's World Insight, amid an apparent COVID-19 ebb in China, the WHO cautioned containment must go on. A one-on-one with the WHO rep who led a joint team to China.
Complacency is always the biggest risk when it comes to dealing with a virus.
And woes over COVID-19 testing and outbreak response in the U.S. A former U.S. CDC chief and another public health expert shed some light. Here is our host, Tian Wei.
Hello and welcome to World Insight, coming to you live on CGTN from Beijing. I'm Tian Wei. We begin today's program with the apparently waning COVID-19 epidemic in China. The number of new cases have fallen significantly, with 120 on Tuesday. Almost all of them were in Hubei province, where the outbreak began. Meanwhile, the WHO chief said on Monday that focus was shifting to countries outside China, where the virus was now spreading much faster. More than 12,000 cases have been reported outside China in 76 countries and regions now. South Korea is still the worst hit, followed by Italy and Iran. In late February, a WHO team joined the Chinese scientists in touring 5 Chinese cities to study the epidemic and to determine how effective the response was. They later released a report about the result. Does China's experience apply in other countries or be of any help to the others? Earlier, I talked to Dr. Bruce Aylward, the WHO Assistant Director General, who led the joint mission. He told me now it is the time for China to not relax, and for the world, hard lessons from China's experience are helpful. For more, joining us in Geneva, Bruce Aylward, the WHO epidemiologist who also led the WHO China joint mission on COVID-19. Dr. Aylward, welcome to CGTN.
Thank you very much, Wei.
You were not sleeping at all during your days in China. I hope you catch up a little bit with the sleep while you're back in Geneva.
No, since we got back from China, we had to get the report finalized, and then we had to share the findings. And Wei, there's been a tremendous interest in what happened in China, so we haven't got much more sleep even since we've gotten back. Also because, of course, there's been the developments in the other parts of the world where the disease has escalated since our return.
Talking about China's case, the day you left to now, there seems to be quite a huge difference. Today, only 4 new confirmed cases outside Hubei. Dr. Aylward, what's your assessment of the latest?
I think this is what we expected to see based on the epidemiology that we saw in China, the control measures that were being applied, or containment measures, and then the impact of those measures. I also expected that at a certain point there was going to be a rapid decline in cases, and that's exactly what we've seen in China. And this is so important to the rest of the world because it's further affirmation that even when the situation gets what looks like it's quite out of control at some points in other places, you actually can contain this virus. So everything we've seen since leaving China is consistent with what we saw in the country and what one would expect. But it's very, very impressive, and it still is the standard for the rest of the world.
What do you consider still as the biggest danger facing China? Now, a lot of people have been talking about the danger of imported cases, meaning others traveling from abroad into China, and as a result, the spread of the virus. But Dr. Aylward, without stigmatization, of course, what is the biggest danger you think that is facing China today?
The single biggest danger is complacency, and this was something we talked about in China a fair bit, that people drop their guard against this disease. This is still the same virus that caused the situation we see and still dealing with in Wuhan. It is still a very serious situation and a very concerning virus that can wreak havoc. And the moment we drop our guard, a virus like this is going to take advantage. It's going to start to spread again. And one of the things that most impressed me in China was, as I spoke to governors and mayors in different provinces, even though cases were coming down, they were still building beds, buying respirators, because they said, look, if this happens again or cases start to increase as children go back to school, as factories reopen, we have to be prepared for it. And I think the really, really striking thing in China is, as you've had importations, you've found them quickly, found their contacts, got them isolated, and demonstrated again to the world that this is manageable, whether the disease arises from within the country or you get importations. But complacency is always the biggest risk when it comes to dealing with a virus, any disease, when it's in decline.
Complacency, complacency, complacency. You offered that advice days ago when you were in China. Now, how would you compare what's going on in the rest of the world? Now we know the number of confirmed cases have been rising very fast, and as you said earlier, things are happening fast in this epidemic. So anything they could do?
Yeah, absolutely, Wei. I think what we're seeing in the rest of the world are two, possibly three patterns, and it's not unlike what we saw within different areas of China. What we're seeing is sporadic importations in places, take Canada for example. They've had a number of cases, they're getting found quickly, they're quickly acting on them, following exactly the same public health principles you employ in China. And then we have a separate situation where we're getting undetected spread early on, and then that exponential growth which takes off and gets you in trouble. This virus moves very fast. It's that exponential growth that you're trying to prevent. And what we're seeing in Italy, what we're seeing in Korea is exactly that situation. But that's not the situation everywhere. A lot of countries have really taken to heart what they've learned from China, what we've been talking about. They're rapidly finding these cases, rapidly containing them, using the principles that China employed. They're not learning from scratch.
At the point when you were in China, do you find much evidence at all there were underreporting? Because the numbers are extremely important in terms of what measures to take in order to fight against the virus.
Sure. Well, that's a really important point, Wei, because in the world I work in, there's two things are important, but the most important usually is the trend. Are cases going down? Are cases going up? Right. What does that angle of increase or decrease look like? Because that's really what tells you what's happening to this virus. And the first thing I would say in China is that we have absolute confidence, and this is not me speculating, this is a group of international and national experts, independent of what happened in China, looking at different pieces of information and coming to the very, very robust conclusion that the decreasing trend is absolutely real, no question. Are you finding every case? No. We never find every case in a situation like this. But what you're looking for, again, the second thing you're looking for is not necessarily every single case. That has to be your goal, every case, every contact. But the key thing you're looking for is every chain of transmission. And the chains of transmission, they make themselves known very quickly because they explode with this disease. And the evidence from China suggests that you're finding the vast majority of chains of transmission, and you're finding them fast. There's a number of indicators that support that. So those are the two key things. What's happening with respect to the trend, and then what's happening in terms of the chains of transmission. Both counts, and again, it wasn't easy for China. You know, one of the things I learned a lot, and people were very, very honest. They said, look, we had to learn this, and we had to learn it fast, and we, you know, there were shortcomings, there were obstacles. Yeah, that honesty about some of the problems really helped me yesterday when I was talking to people running the Iranian response, people running the Italian response. You know, I was able to bring it alive in terms of what China was doing, and that really, really helped them.
I see. According to the latest report, research suggested that the virus has been mutating quite much. In fact, according to the latest research, 194 latest mutations, and the virus is going very differently in different parts of the world. Dr. Aylward, you've been an epidemiologist for decades, and you witnessed some of the biggest outbreaks of some of the most important viruses we've seen over the years. What do you make of the latest development?
Yeah, so first of all, I'm an epidemiologist, like you said, not a virologist, but by the same token, there are some really important features. What sounds like a lot of change in a virus sometimes is not as meaningful in terms of your ability to respond and manage it. And what I mean by that is the coronaviruses are actually fairly stable viruses. All viruses change, mutate, and evolve, as your viewers will know. Some of them are notorious, such as the flu virus, which is part of what makes it so difficult to manage. HIV virus also can mutate in ways that can make it difficult for control measures to affect it and certain targets. But with this virus, even though there's changes, it's behaving the same way. The basic characteristics about how it transmits, the case fatality, how it causes disease, those are remaining quite stable. And this is really important because there's a danger that people could start to think, oh, it was bad in China, but now it's mutated and it's not as bad. It only causes a cold. That is not the case. So I think it's a really important thing to bear in mind. I'm glad you raised that.
Dr. Aylward, when I was listening to you just now, I was thinking, there's still a lot of people wondering, whether this COVID-19 is as serious as a flu. You know, let's just debate where the source was for the COVID-19 before we jump on to save our lives. And there are also others debating, whether we should have some of the contingency plans, as you said, complacency, whether we should have that going because we also have another priority. So listening to your advice earlier really reminds me a lot of these talks going on. What do you make of them, Doc?
Yeah, so there's three questions in what you just asked, Wei, but the most important is the comparison to flu, and that has to stop because one of the things that we really noticed as we got to understand the virus in China, because we had so many numbers and such power of information, this is not flu. It's not SARS, but it's not flu. It's a new coronavirus, and we have to respect that. The thinking is, and so far all the evidence, that you cannot stop a flu virus the way you've been able to stop COVID, because it's a different virus, transmits, some of the features about how it transmits among populations are different, which gives you room to attack it with the public health measures, the case finding, contact tracing that you did. So it's different than flu in that regard. The other thing is, this is not a bad flu. This is a virus that kills up to 2% of the population, and it kills a lot of your elderly. This is a serious or very concerning virus. And I think those comparisons to flu, because flu people know is seasonal flu, and the mortality rate is much, much lower than what we're seeing, sometimes an order of magnitude lower than what we're seeing with this disease. And when was the last time we saw flu cause the societal and economic devastation that COVID does? So I want to hammer that point a little bit because I dealt with it even here in a question and answer situation in WHO.
Yeah.
So important we're clear on that.
Yeah.
We also have to figure out where this virus came from, because if we don't know that, it can come back again. So we've got to figure that out just like we did for SARS, and I'm sure we can. There's some good things in China already happening to look at that. But the big point you made, and the last one around complacency, in China, I say that's the big risk, but I've never seen a country work so hard to not be complacent. In China, I found such a pragmatism. People are saying, look, this disease may not disappear again like SARS did. We may just have this in our population, and what we've got to do is learn how to run our economy and everything with it. And they're preparing for that, contingencies for that. And so far, we're seeing it work. Again, we're still early in this disease, but China's leading the way.
On the other hand, we still have not seen successful yet therapeutic treatment or drugs specifically targeting at this coronavirus COVID-19. Meanwhile, we also do not see yet on the immediate horizon about vaccines. So many people wonder what's going to happen with COVID-19 as more cases reporting around the world, as the cases coming down to China. What's going to happen? What's likely to be the trend? Dr. Aylward.
Yeah, super important question, Wei. And this is where this disease, it's another way that COVID-19 is different than flu. With flu and pandemic flu, we've been making vaccines for years. We know how to make flu vaccines. It's simply a matter of time to get your flu vaccines developed, designed, and then in use in flu epidemics or pandemics. COVID-19 is different. We do not have a good track record with vaccines against these viruses, nor do we have a good track record with therapeutics. And that makes the approach from China so much more important, and that's part of the message I'm giving to the world is you have got to contain this virus with traditional public health measures, because we're not going to have a vaccine in the next 6 months and possibly much longer. We are not going to have necessarily a therapeutic in the very near term, because even if we do get a therapeutic that works, we're going to have production issues, etc.
Right.
The key thing right now is prevent the disease, and when you have it, contain it and stop the transmission chains.
So you are saying let's have tailored approach, just as some of the cases here in China, and try to do things fast with that so-called whole nation approach, but very tailored in when we try to do it in different parts of the world. Is that what you're trying to say, sir?
Well, that's another point, but it was a really big learning from China, and I have to say how grateful I am for the patience of the Chinese colleagues who explained this to me, because there's many people think China took a one-size-fits-all approach and just said, everybody, we stop the schools, we stop the roads, everybody stays at home, etc. And it wasn't. It was a much more tailored approach. I heard that again and again and again in China. Do you have 0 cases in your area? Do you have sporadic cases? Do you have clusters or community transmission? And what are your capacities? And you tailor your approach to that. A really important message. But more important is the tailored approach works. It's not a compromise, it's a tailoring. And that's a big message we're giving to the world.
Absolutely. Dr. Aylward, I understand that you were in Wuhan. So what was it like for you and your team to be there? Who have you talked to? With what kind of conditions were you talking to them? What kind of info were you trying to get? Did you get all the info that you desired? And how do you see the doctors and the medical workers there be able to protect themselves? How were they interacting with the official side and also the patients? How does that work, Dr. Aylward?
When I pulled into to Wuhan, and by the time I left, about 36 hours later, it was at one level heartbreaking as I listened to the stories of individuals and the Chinese, just wonderful people, and the people of Wuhan, how they speak to you and tell you what they really think. So it was heartbreaking to understand the loss of life, the devastation, the impact so much beyond the disease itself, and how deeply scarred the population would be. But much bigger feeling that I left with was how inspired I was. I left with such a deep admiration for the people of Wuhan and for Chinese society in general, because what I saw was a tremendous sense of responsibility and of duty to protect their families, their communities, and even the world from this disease. It was truly inspiring. No matter who I spoke to, whether it was a translator, whether it was someone in a train station, when we pulled in, it was always the same message. This is our duty. This is what we need to do. And that's a very hard thing to do a month into this. So, those were the big feelings. Now, while we were there, we tried to see every aspect of the response. We talked to the political leadership. We talked to even Minister Ma, who was managing, you know, the key piece of the response there. We spoke to people who were in the trenches doing the contact tracing, trying to help find the contacts. We talked to people in the stadiums who were taking care of the mild cases. We talked to doctors who were taking care of the severe cases. We talked to nurses running the fever clinics. We talked to so many different folks to try and get a feel for what was happening there. And what we saw, again, it was inspiring and helped us admire how the systems that have been developed. And you know, another word that I heard a lot in China was the need for an orderly approach. And I'm sure at some point things were chaotic. They have to be when you have rapidly, exponentially increasing disease. But the order that had been brought to so many different aspects of the response, whether, you know, refitting stadiums, refitting hospitals, etc., was impressive indeed.
Dr. Bruce Aylward, the WHO epidemiologist who also led the WHO China Joint Mission on COVID-19. Thank you so much, sir. Really appreciate it. Do get a little sleep if you can.
Thank you, Wei, and thank you for what you do. Journalists and people with a platform like yours are so important to this disease. It's what the population knows, what they understand, and understanding it accurately, because the population is what's going to stop COVID. Not the doctors, not the nurses. We deal with consequences. It's your population and people like you who are telling them what to do that are so important. So thank you for everything you do as well.
Thank you, Bruce. Hope to talk soon.